Hello everyone from Geneva. Welcome to regular press conference on COVID-19 from our headquarters. Today is a big day for us. It's the first time that we will have a simultaneous interpretation of this press conference in 6 UN languages. That's Russian, English, French, Chinese, Spanish, and Arabic. We welcome all journalists who are watching us on Zoom. Those who are watching us on Zoom can select the language where they can listen this press conference. They can also, you can ask your question in any of those 6 official UN languages, and it will be interpreted here directly by our team of interpreters that we thank very much for being with us today. Please speak slowly, and so interpreters can follow what you are saying. Then I will quickly translate question in English for all those who are watching us on our social media platforms, where we will not have a interpretation, and then we will have answers. So this is the first time we are trying. We are trying to promote to all countries around the world that this is something that we have from today. So hopefully in the future we will have journalists from every corner of the planet. So let's see how it works. I give the floor to Dr. Tedros.
Thank you, Tariq. Vala. Good morning, good afternoon, and good evening. First of all, I would like to wish all who have celebrated Orthodox Easter yesterday, Happy Easter, including my own country, Ethiopia. Today is the first day our press conferences are being interpreted in all official United Nations languages: Arabic, Chinese, French, Russian, and Spanish. And soon we will start Swahili and Hindi. And we would like to make our UN truly multilateral by including more languages, so communicating with the whole world directly. And I would like to welcome all journalists from around the world, and I invite you to ask questions in any of the 6 UN languages, for the time being, of course. And we will keep opening up more languages. And I would like to start by thanking the many musicians, comedians, and humanitarians who made Saturday's One World Together at Home concert an enormous success. So humbled, and the whole WHO community is very, very grateful for the support that really poured all the 8 hours. WHO is proud to have co-organized this event with Global Citizen, my brother Hugh Evans, and also Lady Gaga. And I also want to thank my colleague Paul Garwood, who came up with the idea and has worked incredibly hard for several weeks to make it happen. Paul Garwood is one of our colleagues in the front line. I asked my colleagues to give me crazy ideas, and he did. But as a boss, I take all the credit. And we shouldn't, and I shouldn't do that. And all the credit goes to my colleague, Paul Garwood, from our communications department, who actually told me this idea, suggested this idea, based on my request to all staff who I asked to give me crazy ideas. And I hope all my staff will continue to give me crazy ideas, and my respect and appreciation to all my staff. I'm proud to be WHO. Very, very proud. The event raised more than $127 million to support several organizations responding to COVID-19, including $55 million for WHO Solidarity Response Fund. The fund has now raised more than $194 million from more than 270,000 individuals, corporations, and foundations. Yesterday, I had the honor of addressing health ministers from the G20 countries. I appreciate the expressions of support from many countries for WHO's coordinating role and our technical guidance. I also appreciate the statements of the G77 and the non-aligned movement expressing their strong support for WHO. As you know, G77 in 133 countries and the non-aligned movement 120 countries. This is a big vote of confidence, and we thank NAM and we thank the G77 countries. WHO's commitment is to science, solutions, and solidarity. Our commitment is to supporting all countries to save lives. That's it. That's our intention. That's what we are for, saving lives. We have spoken previously about the factors countries must consider as they plan to start lifting the so-called lockdown restrictions. We want to re-emphasize that easing restrictions is not the end of epidemic in any country. Ending the epidemic will require a sustained effort on the part of individuals, communities, and governments to continue suppressing and controlling this deadly virus. So-called lockdowns can help to take the heat out of a country's epidemic, but they cannot end it alone. Countries must now ensure they can detect, test, isolate, and care for every case and trace every contact. We welcome the accelerated development and validation of tests to detect COVID-19 antibodies, which are helping us to understand the extent of infection in the population. WHO is providing technical, scientific, and financial support for the rollout of seroepidemiologic surveys across the world. Early data from some of these studies suggest that a relatively small percentage of the population may have been infected even in heavily affected areas, not more than 2 to 3%. While antibody tests are important for knowing who has been infected, tests that find the virus are a core tool for active case finding, diagnosis, isolation, and treatment. One of WHO's priorities is to work with partners to increase the production and equitable distribution of diagnostics to the countries that need them most. To achieve that, WHO has worked with FIND, the Foundation for Innovative New Diagnostics, and the Clinton Health Access Initiative to identify and validate 5 tests that have been validated and can be manufactured in large quantities. Working together with the Global Fund, UNICEF, and UNITAID, we have now placed orders for 30 million tests over the next 4 months. The first shipments of these tests will begin next week through the United Nations supply chain we have established with the World Food Programme and other partners. Solidarity flights continue to ship life-saving medical supplies across Africa to protect health workers who are on the front lines in the effort to save lives and slow the pandemic. Over the past week, WHO has been working closely with the World Food Programme to deliver masks, goggles, test kits, face shields, and other medical equipment to 40 countries. This is part of the overarching drive to keep supply chains moving and ensure key supplies reach 120 priority countries. Through April and May, we intend to ship almost 180 million surgical masks, 54 million N95 masks, and more than 3 million protective goggles to countries that need them most. I also want to highlight the JACMA Foundation's donation of 100 million masks, 1 million N95 masks, and 1 million test kits to WHO. We had a very productive discussion with JACMA yesterday, and he would like to continue to support countries in need. We're also continuing to lead research and development efforts. So far, more than 100 countries have joined the Solidarity Trial to evaluate therapeutics for COVID-19, and 1,200 patients have been randomized from the first 5 countries. This week, we expect that more than 600 countries will be ready to start enrolling patients. The faster we recruit patients, the faster we will get results. Finally, yesterday marked 1 year since our colleague, Dr. Richard Muzoko from Cameroon, who was fighting Ebola, was killed while working on the Ebola response in the Democratic Republic of the Congo. After 54 days without a case, there have now been 6 cases of Ebola in the past 10 days, and no cases in the past 2 days, of course. We're continuing to work hard with our partners to support the government to ensure that this spark does not become a larger fire. Unfortunately, Richard is one of many health workers who have lost their lives in the line of duty globally in the past year. Some have died in attacks on health facilities. Some have lost their lives to COVID-19. I would like to use this opportunity to pay tribute to Richard's family and also to Cameroon. I would like to once again pay tribute also to every health worker. We salute you, and we're committed to supporting you. We don't take your commitment and heroism for granted. Thank you for saving lives, putting your lives at risk. Saving lives while putting your lives at risk. There is nothing more blessed than what you're doing. Please keep doing what you're doing. Save lives. From WHO and the whole world, you have the greatest respect and appreciation. I thank you.
Thank you very much, Dr. Tedros. We will open the floor to questions. So just to repeat again, because we have today simultaneous interpretation in 6 UN languages, please speak slowly, be brief, and ask only one question. If question comes in other language than English, I will repeat the translation of that question in English for those who are watching us on social media platforms where the interpretation is not available. So let's try to see how it works. So we will start with Marie from Le Monde. Marie, can you hear us?
Bonjour, merci de prendre ma question. Donc, ma question porte sur le contentieux qui entoure l'email qui a été envoyé par Taïwan le 31 décembre. Est-ce que vous pouvez préciser l'heure à laquelle cet email a été envoyé et au contraire, à quelle heure l'alerte chinoise vous est parvenue? Et quelle est votre réponse aux accusations taïwanaises d'avoir manqué à votre devoir de vigilance concernant l'envoi de cet email? Merci.
Merci beaucoup, Marie, pour cette question. And so, quick translation of that. Marie is asking about an email that has been sent by Taiwanese health officials to WHO on 31st December. So the question was when this email arrived, when we had the first announcement by Chinese authorities of cases of unknown pneumonia, and how do we answer to claims that WHO was not acting on warning from Taiwan. Thank you.
On the 31st of December, information on our epidemic intelligence from open source platform partners, ProMed, was received, indicating a signal of a cluster of pneumonia cases in China. That was from open sources from Wuhan. On the same day, we had a request from health authorities in Taiwan, and the message referred to news sources indicated at least 7 atypical pneumonia cases reported in Wuhan media, that the cases were not believed to be SARS, however, that the samples were still under investigation. The message requested, with great appreciation, if we had relevant information to share, with a thank you in advance for our attention to the matter. There was no reference made in that query to anything other than what had been previously reported in news media, and actually referred to a response from the Wuhan health authorities clarifying and confirming that the cases existed, the cluster existed. And obviously it turned out not to be SARS. So any SARS test done at that time would have been negative, as would have been influenza samples. Clusters of atypical pneumonia are not uncommon. There are millions of cases of atypical pneumonia around the world in any given year, and certainly in the middle of an influenza season, negative influenza tests may also have been found at that time. So from the perspective of the request we received from Taiwan, it was in line with other information that we had received from other sources, and the message through the iOS platform from ProMed actually had a lot more detail in it based on the news media report, and that request was actually sent immediately on the same day to our country office for follow-up with Chinese authorities. And on the 1st of January, we formally requested verification of the event under the IHR, which is a formal process of beyond any informal verification, which requires a response and requires an interaction from the member state. Under the IHR, member states are required to respond within 24 to 48 hours of any request from the WHO for clarification or verification of an event or a signal that we believe may be significant. That process continued, and on the 4th of January, WHO tweeted the existence of the event, and on the 5th of January provided detailed information on our epidemic or our emergencies information site, which is a site for all national focal points around the world. In every member state has a focal point for IHR, usually within the National Health Service, and all would have received a detailed report from WHO giving details on the event, and that would have included an IHR contact point for Taiwan. Taiwan has access to that site, as have other focal points and contact points around the world. On the same day, we would have actually put out our first disease outbreak news, which was a public explanation or a public report on the event, and the process continues after that. So we would obviously like to thank our colleagues in Taiwan for having shared an interesting report, for which we were receiving similar reports from other sources. At no point in the process of communication in this email that's been received was there any reference to human-to-human transmission or any other issue. It was purely requesting relevant information and thanking us in advance for our attention to the matter. So I hope that clears up that confusion.
Thank you very much, Duran. I hope this answers the question from Marie. Now we will go to Kim Please, Dr. Tedros.
So I think Mike answered it very well, but I just wanted to summarize. In its email on 31st December, one thing that has to be clear is the first email was not from Taiwan. Many other countries have already were asking for clarification. The first report came from Wuhan, from China itself. So Taiwan was only asking for clarification. And as some people were claiming, Taiwan didn't report any human-to-human transmission. This has to be clear. They were asking for clarification like any other entity who wanted clarification. So we didn't receive the existence of human-to-human transmission from Taiwan on December 31. We have all the documentations, and the email we received from Taiwan is to get more clarification on the issue based on China's report. So the report first came from China. That's number one fact, from Wuhan itself. Second, the email from Taiwan, like other entities, was to ask for clarification, nothing else.
And I may also just add that for those of you who don't know, ProMed has been in existence for more than 20 years and is actually a US-based listserv that has provided a lot of early information on epidemics going back over decades. We work with them very closely, and we have actually co-developed with ProMed, with GFIN, which is a Canadian public health intelligence network, and many others around the world, the Epidemic Intelligence from Open Sources platform, which is an AI-driven system which allows the automatic detection of these types of reports all over the world. Our system picks up 7,000 signals, and we pick up those 7,000 signals a month from all around the world, and they all require verification and follow-up investigation. Up to 300 of them require investigations specifically by governments, and it's a massive global process of picking up this information from around the world. And actually all of the G7 countries are now implementing EIOS as part of their core public health architecture, and that system would have been live in all G7 countries at the time of these notifications.
Thank you very much. Hope this answers the question from Marie from Le Monde. Now we will go to USA Today. That's Kim Hjelmegard. Kim, can you hear us?
Yes, I can hear you. Good evening. A Washington Post story over the weekend suggested that American officials, either working for or with the World Health Organization, communicated January and February information about China's outbreak directly to the White House in real time. Can you confirm if that is accurate? And if so, provide any details about those specific warnings?
I'm not aware of any specific communications between US government officials or who are based here in WHO with ourselves and the White House. I am sure there were many warnings, because WHO itself was clearly putting out information on this event since the very beginning. I'd be surprised if there weren't some science-based discussions going on around the implications of this event. In fact, I'd be quite shocked if there weren't. But I do know, what I can tell you is that we, as WHO, since the 1st of January, and we've had 15 US government secondees embedded in our program specifically on COVID. Since that time as well, on Ebola and going back into last year, but just since the 1st of January, 15 others. And we have 2 permanent US government secondees within our program. So in effect, there are many, many, many US government employees for whom we are extremely grateful who work with us and have worked with us in the front line, in the trenches, in the back line, in our epidemic intelligence, in our verification, in our risk assessment, in our risk management, in our innovation. There are US government employees across all of our virtual expert networks and hundreds of individuals from US institutions who are amongst the best in the world. We are very grateful for US innovation, US knowledge, and superb officials who've joined us here over the months and over the years. I have served in the front line with some of the finest scientists that I've ever met, and they've been from places like the US CDC, from NIH, from the FDA and others. So we are hugely grateful for the contribution and the major contribution that embedded US government officials have played since the very beginning of this outbreak, fully embedded into our system here in Geneva.
Thank you very much, Dr. Ryan. Hope this answers question from USA Today. Now we will try to go to Morocco, where we have Abdallah. Abdallah, can you hear us?
نعم نعم.
Please go ahead. مرحبا بك.
هل تسمعوني؟
نعم.
شكرا لكم على اختيار سؤالي. سؤالي كالتالي: هو معدل انتشار فيروس كورونا بالمغرب، مع العلم أننا أصبحنا نسجل أكثر من 1000 حالة في الأسبوع. هل الوضع الصحي مسيطر عليه؟ هي التدابير التي يمكن أن يتخذها الشعب المغربي والمسلمين عامة خلال فترة الصوم في رمضان المبارك؟ شكرا لكم.
شكرا لك على هذا. So, question is about Morocco. Morocco has a reported number of cases, more than 1,000. How WHO is helping Morocco, especially now as we come to the month of Ramadan?
Assalamu alaikum. The WHO has been working very closely with the government of Morocco. In fact, very closely indeed with Morocco on preparedness for epidemics and emergencies in general. We sadly had to postpone a hugely important global meeting on exactly this topic, which was actually planned for last month in Morocco under the stewardship and sponsorship of the King, on the need for accelerated global epidemic preparedness. So we've been working extra closely with Morocco over a large number of months on the topic of epidemic preparedness. With regard to the response, our Eastern Mediterranean Regional Office based in Cairo has been working very closely with Morocco on diagnostic testing, on many other aspects of the response. With regard to the holy month of Ramadan, the Eastern Mediterranean Office, again in Cairo, has been providing global leadership across our organization in developing detailed guidance for authorities and for religious authorities on the safe implementation of Ramadan celebrations and Ramadan observances. That advice, I believe, is now available. We also, through the EpiWin platform, through our network for information for epidemics, have engaged specifically with religious communities, and within that specifically with those of the Islamic faith, to work on how we can reduce risks and use the hugely valuable resource of religious networks to get the message across about risk reduction, about hygiene, but also to make religious observance safe. And we thank those leaders in the Islamic community who have engaged so closely with us in this regard. With specific reference to I believe we've had a surge team that has visited Morocco to support there, but I would have to get more details on the specific nature of the technical assistance we've provided, but we'll be very happy to do so. Maria?
Yeah. To supplement that, so Morocco has incredible leadership and work that they've done in the past on influenza and on MERS. And through our regional office, our Eastern Mediterranean Regional Office, have built up capacities over many years, over decades, in terms of abilities for diagnostic testing, which has been valuable for COVID-19. In addition to that, people from Morocco have participated in many trainings that have taken place over the last many years relating to rapid response teams in terms of how to find cases, how to do contact tracing, how to do these detailed investigations around cases and clusters. And so from that work from influenza, from that work from MERS, and now with this work with COVID-19, there's an incredible base to be able to respond. Reflecting on what you've said in terms of 1,000 cases per day, there certainly is a challenge ahead in terms of being able to identify and care for those cases. WHO has provided guidance to Morocco and to all in terms of how to care for cases, how to manage cases, whether these are cases who have mild disease, and they could be cared for in a medical facility or at home safely, and severe cases as well. And so there's guidance that is available to everyone, which we have made available through our website and through our regional office, and to provide an exchange between technical counterparts and people on the front line through our open WHO platform via trainings. So there's a lot of materials that we have provided for all countries, including Morocco, and we know that you have the capability to be able to work through this and to mount a good fight.
Thank you very much. Hope this answers the question of our colleague Abdullah from Morocco. Now we will go to Valentina from Sputnik. Valentina, can you hear us?
Hi, can you hear me?
Yes, please go ahead.
Thank you very much for taking my question. I would like to hear WHO's opinion regarding the recent study by the Stanford University. It hasn't been peer-reviewed yet, but it is based on antibody samples from some 3,000 people in California and suggests that the actual number of COVID-19 cases may be 50 to 85 times higher than the official figure. You previously said that we might be missing out some mild cases, but does WHO have any data or reason to believe that the actual number might be so much higher? And could it mean that we are on the track to get so-called herd immunity across the globe? Thank you very much.
So thank you for the question. So yes, we are aware of a paper that's been put in pre-publication. So this is on one of those online servers that some researchers put their papers on before they go through peer review. And it is a paper that looks at antibody levels in Santa Clara, California. This is one of many studies that is currently underway, that is currently in pre-publication, which is attempting to look at the presence of antibodies in individuals in different countries. And so the goal of this study is to be able to detect unrecognized cases that may have been missed through current surveillance systems, which is now how cases are being picked up through molecular testing or the PCR testing. So this study is one of many which has suggested that there's a proportion of the population who have antibodies to COVID-19. I'm not going to comment specifically on what percentage this study had, but what I can say is that a number of studies, which we are aware of, again, in pre-publication, we haven't seen the full details of all of these papers, have suggested that a small proportion of the population, a few percentage in the single digits, up to 14% in one study that we've seen in Germany, have antibodies to COVID-19. So that means that they have evidence of past infection. It doesn't mean active infection. It means that they had infection at one point in time. What is really important for us to be able to do to put these numbers into context is to understand how the studies were done. For example, how did they find people to test? Where did they look for those subjects? Is it a random selection of people in the population? Does it come from blood donors who tend